Today I'm going to talk about flossing. Flossing is an integral part of oral hygiene routine. So, what is flossing? Why do you need to floss, and how often should you do it? Flossing is supposed to remove what is left by the toothbrush in between the teeth. The bristles of a toothbrush cannot be able to get in between the small spaces of the tooth, so you need to use floss to augment the brush you're brushing. Now, once a day is sufficient with flossing. Before you go to bed, that is actually quite sufficient. Now, there are different types of floss in the market. This is the commonest type of the floss in the market. You'll get it in the supermarket, in the chemist, and then there are other types of flosses like this one. This is called a floss pick. So I'm going to, the technique is basically the same. So I'm going to demonstrate how you can use the floss effectively so that it's not a complicated procedure on your end. I'm going to show you how to use dental floss. So we'll start with this common type of dental floss. So what you want to do is to just pull a significant part of it. We say around 18 inches. I don't know how to measure that. So you just, when you have like such a piece of, let's call it dental string on your hands, so you're going to cut it from here. And you're just going to roll it like this. How I'm doing it. Sorry. Such that you have that part left on your hands, this amount of floss. So you're going to start from one end so that you're not confusing. So if you're going to start on this end, so you're not going to land on the gum straight. This might injure your gum. So what you want to do, you want to follow the contour of your tooth up to the gum level. Then you're going to clean that tooth like this, up and down. And then you're going to use the same floss and go to the other tooth, follow up to the contour of the gum on that other side. Then you're going to have up and down strokes. So what you're doing is you want to remove any food particles, any bacteria, any plaque that is in between these surfaces of the tooth. Then when you're done, you're going to remove it. Then you're going to move a little bit on the same floss because you don't want to pass the whatever the debris gotten from the first tooth to the next tooth. So you're going to have a cleaner floss. Then you're going to go in again, as I said, you're going to just take it, don't go into the gum. You're going to follow the tooth and go into the contour of that tooth. Then you're going to clean up and down on this tooth from the gum and then the other tooth. Then you're going to remove it. Then you go to the next tooth. The same thing, you're going to move from the dirty part to another part. That's why we cut a big part and you're going releasing it slowly by slowly. So you're going to do this for every tooth, every in between two teeth. And remember, we're not trying to injure our gum. You're just going to go slowly. When it sets in, you follow the contour of that gum like that, and then you remove it, and then you go to the other tooth and then you remove it. So you're going to do that for the upper and for the lower, and this should not be too taxing because you're doing it once a day. And you know, when you flossed the upper and the lower teeth, remember it's up to the back of the upper tooth, up to here. So you're going to go to all these spaces, and then when you're done, you're now going to brush your teeth, because remember, you cannot brush and then floss, because where would that dirt go, whatever you've gotten out. So you floss, and then you're going to use the toothbrush now to come and collect all that debris to remove it from your gum. So you're going to do this. It's a bit taxing, but should take you less than 5 minutes to floss up and lower, because you know we are assuming you have healthy gums, so it's something that you're doing as a routine treatment before you go to bed. The other type of floss is the pick flosses. These flosses are very convenient in that they are portable. So, but how do you use them? You need to, you need to use it effectively, not by just putting it in and out. So the correct technique to use the pick flosses is when you take it in, it needs to go to the contour of the gum, and then you clean that area. Then on the other side, clean this area, and then same here, you'll need to go into the gum, not hurting the gum, but just the control of the gum, and then you're cleaning this tooth. Ideally, you should not use the same place twice. So if you're able to, you can use separate flosses. That's why I say this one you can carry it like if you have food lodged in between your teeth, and then maybe at night when you're doing the whole mouth, you use the conventional floss. But either way, at least if you are flossing, we are starting from somewhere to remove the dirt from the interdental spaces. That's fine.